If you've been experiencing pain along the outside of your elbow when lifting, gripping, opening jars, shaking hands, or even pouring a cup of coffee, there's a good chance you may be dealing with tennis elbow. Despite its name, you don't have to play tennis to develop it. The good news is, with the right treatment, most people recover without surgery. In this video, I'll explain what tennis elbow is, why it develops, and what actually happens inside the tendon when this condition occurs. By the end of this video, you'll understand why tennis elbow develops and why modern treatment focuses on gradually improving the tendon's ability to tolerate load rather than simply trying to reduce inflammation. So what is tennis elbow? Tennis elbow, also known as lateral epicondylitis, is one of the most common causes of pain along the outside of the elbow. The most important thing to understand is that tennis elbow is a tendon injury. A tendon is the strong tissue that connects a muscle to a bone. On the outside of your elbow is a small bony bump called the lateral epicondyle. Several of the muscles that straighten your wrist and fingers attach to this area through a common tendon. Every time you grip, lift, twist, carry, use a screwdriver, swing a racket, or even hold a coffee mug, these muscles and tendons are working. Think of the tendon like a rope connecting the muscles in your forearm to your elbow. Every time those muscles contract, they pull on that rope. Most of the time, that's exactly what it's designed to do. But if it's repeatedly asked to handle more stress than it's prepared for, the tendon can become painful. That's exactly how tennis elbow develops. Rather than one major injury, it usually develops gradually from repeated overload. Over time, the tendon is asked to do more than it can recover from, leading to pain and changes within the tendon that can make everyday activities more difficult. The tendon most commonly involved is called the extensor carpi radialis brevis, although nearby tendons can also contribute. One of the biggest changes in how we understand tennis elbow is that it's not simply an inflammatory condition. For many years, we believed tennis elbow was caused primarily by inflammation. We now know that's only part of the story, especially in people who've had pain for several months. The tendon often develops gradual changes related to repeated overload rather than ongoing inflammation alone. This is why rest by itself usually isn't enough. Instead, modern treatment focuses on gradually rebuilding the tendon's strength and its ability to tolerate load through progressive exercise. That's a concept you'll hear me come back to throughout this program because it's one of the keys to successful recovery. So who gets tennis elbow? Despite the name, tennis elbow isn't just a problem for tennis players. It can affect anyone who repeatedly uses their forearm muscles. It's especially common in people whose jobs involve repetitive gripping, lifting, twisting, or using hand tools, including construction workers, electricians, mechanics, plumbers, painters, and many others. But it's also common in office workers, musicians, artists, golfers, racket sport athletes, weightlifters, and people who spend long periods of time using a computer mouse or keyboard. In other words, if your forearm is repeatedly doing the same job day after day, the tendon can eventually become overloaded. The good news is you're certainly not alone if you're watching this because you've developed pain along the outside of the elbow. Tennis elbow is one of the most common elbow conditions we treat, and the vast majority of people recover without ever needing surgery. The key is understanding what's happening, managing the amount of stress placed on the tendon, and progressively rebuilding its strength over time. Throughout this program, I'll show you exactly how to do that. In the next video, we'll discuss how tennis elbow typically presents, the most common signs and symptoms, and how to determine whether it's actually the source of your elbow pain.